And question number one is there a relationship between vitamin D and sleep?
There is a relationship between vitamin D and sleep, and I can't profess as being an expert on that. I know that when patients have more vitamin D in their system, they're going to do better. They're going to have less inflammation. Their immune system is ramped up a bit. One of the interesting things about vitamin D is that, and sleep, is that we always attribute sleep to being in patients who are more overweight or obese, and vitamin D is stored in fat tissue. So the accessibility of vitamin D is much less in those patients. So therein alone is a relationship between vitamin D and sleep.
Okay, thank you. Question number two, do insomnia medications affect deep sleep?
Well, it depends on which insomnia medication you're talking about. When you talk about the Z drugs, like the Ambien, Zolpidem, and Sonata and Lunesta, they do affect sleep because they're GABAergic. And so they increase the amount of GABA that's being released from the hypothalamus, which in turn allows people or helps people to get into more deep sleep or stage 3, 4, N3 sleep. Other medications that are intended to help with sleep, oftentimes, like for instance, some of the antidepressants will help from the serotonin point of view, but may not help get into as much deep sleep as the Z drugs do. And then certain other over-the-counter medications can have other ramifications to them in that they, like for instance, some people have taken some of the SSRIs and SNRIs to try to help them sleep as antidepressants, and those will actually help them to be more sedated, but it doesn't get them into the deep sleep stage. It actually increases REM.
Okay, thank you, Dr. Bailey. Question three, is snoring always connected to bad quality sleep?
Well, yes, it fragments it. It's going to cause sleep disturbance, and it increases the elbow factor if you have a bed partner.
Right.
There was an article published in the journal Chest, probably about 10 years ago now. It was called the elbow sign. And if somebody was known to get an elbow sign more than a certain number of times, and I've forgotten the exact parameter that they used, that was enough to allow them to be diagnosed as a sleep apneic.
Perhaps you'll understand this, Dr. Bailey. We Canadians play hockey all the time. So I prescribe elbow pads and hockey gear for those situations. And it seems to work well. Okay, next question. Is there a relationship between ADD/ADHD and sleep?
Yes. The reduction of sleep, the fragmentation of sleep, does not allow many of the neurohormones and neuropeptides that I related to help with the quality of brain function, which in turn leads to, in some people, creating more ADD and ADHD. Now, we have to clarify that, because you don't want to just jump to a diagnosis of ADD or ADHD. Is it just hyperactivity in a brain that's tired? A tired brain will lead to more hyperactivity, which is something we have to be very cautious about. But yes, there is a I don't want to say a direct relationship. There is a relationship, a comorbid relationship between them.
Okay, next question. Are the fibro results similar to EDS, excessive daytime sleepiness?
Fibromyalgia is definitely going to have a significant amount of excessive daytime sleepiness. But once again, we go back to the word fatigue versus sleepiness. Many of these patients, because it creates more of an insomnia type condition, are more fatigued than they really are with excessive daytime sleepiness.
Simi, does that answer your question?
I was curious because he posted some results about the nature of the fibro sleep, people who with fibro, and I have EDS, and I'm wondering if it's a similar, if there are any results for that, if they're similar at all. Because I know EDS is often misdiagnosed as fibro.
I would not make that association so clearly, because the only way to really formally diagnose fibromyalgia is with the palpation of the 11 or 12 paired tender points. And so from the diagram that I showed, and I had another picture that I eliminated just to keep the slides to a minimum, but basically these tender points have been recorded by the American College of Rheumatology. These are tender points, not trigger points. The tender points are not heterotropic. They do not refer pain to a distant location, as trigger points are known to do. So unless the patient has palpatory tender points, you can't make that distinction or make that association.
We need a day-long course about menopause and sleep. What are your thoughts? And do you know of any speakers we could invite for that?
Yeah, actually, a person who used to be a Canadian, who now is at Yale, Meyer Krieger.
Okay.
I remember hearing him at a sleep meeting, I can't tell you how many eons ago, talk about that very topic.
Yeah, I remember that as well.
Now, there's another person that you might consider, and that is Susan Redline at Brigham and Women's in Boston at Harvard.
Okay.
Those are two people that come to mind immediately that could talk on that topic fairly well.
Next question. What is your take on cervical instability and sleep disorders / vagus nerve?
There is no relationship between anything cervically with the vagus nerve. There's nothing significant associated with that, absent of any trauma in the area. I mean, just in terms of instability, meaning forward head posture, or the patient has some cervical disc relationship problems, or a radiculopathy of some sort. My understanding or my knowledge at this point, and I could be wrong, indicates that there's nothing that's going to affect the vagus nerve. It may affect some branches of the vagus nerve where it innervates certain structures in the oral pharynx and hypopharynx where it's close to those structures, but not specifically the entire nerve.
Please elaborate a bit on myofunctional therapy and sleep.
Myofunctional therapy is also termed myofunctional tongue therapy. And I'm going to go out on a limb because I don't remember exactly, but I believe one of the webinars I did, I discussed the fact that the tongue is considered to be what is called a muscular hydrostat. So the principle of myofunctional therapy and sleep, particularly airway, is to have the tongue positioned through these exercises in the correct position, meaning that it's in the roof of the mouth as opposed to lying flat and moving back into the oral pharynx. The tongue as a muscular hydrostat simply means that the tongue is, besides 8 muscles or 4 groups of 4 muscles, intrinsic and extrinsic, including the genioglossus, which is the one that gets the most press. The tongue is it can change its shape at will. You can stick it out, you can stick it to one side or the other, and it can change all around. And so as a muscular hydrostat, it has the ability to change dimension, which can put the posterior aspect of the tongue further back in oral pharynx and compromise the airway. So that's how it affects the sleep, is by improving the airway. It's also been shown that myofunctional therapy can greatly influence and improve the function of the TMJs.
Okay, thank you. I'm not much
oxygen desaturation is a factor in pain presentation. And I'm wondering what your comments or thoughts are on the use of wearables that are provided as to the patient to monitor oxygen desaturation when they're asleep at home. What are your thoughts on those kinds of wearables, such as the Ura Ring or the Vivos Ring or or what's out there in the marketplace?
Well, I think monitoring blood oxygen saturation is a good thing to do because the ODI has been shown to be very comparable. Again, demand evidence, think critically, but the evidence clearly shows, and there's a number of articles that prove it, that the ODI and the HI are very closely related. So monitoring that is definitely necessary. Now, as far as its influence on pain, I think it's more the influence on how sleep goes or how sleep performs, which thereby has a bidirectional relationship to one's pain.
Do you have any comments on what's out in the marketplace with regards to these kinds of measurements which are given to patients overnight rather than information coming from the sleep lab?
Well, I think the overnight part of it, where you've got something like a wearable, they're showing a great deal more efficacy and reliability in terms of what they record. So yeah, I think they're going to be the wave of the future and what's going on. I just saw a thing for a smartwatch version 9, I think it is. I have it on slides. That's actually going to be able to record AHI. So, I mean, these things are getting more sophisticated by the day.
Thank you.
Mm-hmm.
Okay, I have a question here, if you don't mind, please.
Yeah, Mohammed, please go ahead.
My question is not a question actually, it's just a comment. That is, you talked about the genoglossus muscle.
Mm-hmm.
And the important, and I know in all these textbooks, they call it the savior because it just opened the, like in a subconscious state. But I keep questioning that myself, and this is for everybody in the audience here. That I question it. I don't, like I say, it's not the genoglossus, because if you look to the genoglossus from the geno to the tongue, and the shape of the genoglossus, the job of the genoglossus doesn't do the job of what we are actually thinking. My theory is the genohyoid muscle. That's why I know that is weird to say, but like when you think about just the anatomy and physiology, the genohyoid make more sense, that help in breathing, than the genoglossus.
Well, like I said before, in reality, if you look at the actual anatomy and you look at the studies that deal with Inspire, for instance, and the studies on myofunctional therapy, there are 4 extrinsic and 4 intrinsic muscles of the tongue, genoglossus and others, genoglossus being the one that's always garnered the most attention. So they come in different directions. Genoglossus is going in one direction. There's others that go perpendicular to it. There's others that wrap around it. Yeah. This is what gives the tongue its unique function.
Thank you.
Thank you very much, Dr. Bailey. Again, I believe this is your 4th webinar, in addition to your live presentation.